Good morning, everyone. I'm Purnota Dattapehel, the founder and CEO of Cuddles Foundation. And I'm very excited about today. What we want to do is to talk to media about childhood cancer. But really, with everything that's happening around the world, it's really tough to get reporters to listen to you when there is just so much happening. So, really, instead of waiting for the reporters to come and listen to us, we decided to be journalists ourselves. And we are here to bring you some hard facts and some trends that we are seeing in childhood cancer patients in the country. I have with me today my colleague Anju, who heads Knowledge and Impact for Cuddles Foundation. And she has put together this brilliant impact report for the year 2021-2022. Joining us also is Dr. Shripriya, who has a PhD in nutrition and also heads content for us. And finally, we are extremely honored to have Dr. Ravi Kannan, who's the director of Chachar Cancer Hospital and Research Center, contributing to this discussion. So welcome, everyone. Good morning. I mean, I've said that, but congratulations on the report, Anju. I want to ask you, why don't you tell us about some key findings of the report? I know you have been working hard at it for all of the last few months. So please.
Thank you, Purnota. Hi, everyone. So what we've seen in financial year 21-22 is that 57% of patients who come to a cuddle center are undernourished. And out of those, 37% are severely undernourished. The good news is that 95% of patients continue treatment when nutrition is a part of it. And also what we've observed is that 81% of our patients' nutritional status has improved or maintained despite cancer therapy like radiation or chemotherapy.
Amazing. I mean, I was noting these numbers down, and 95%, 81%, are such amazing numbers, very hard to see when we are talking about real impact in the beneficiary group like ours and kids like ours. It's extremely heart-rendering to a point to see the kind of malnourishment and undernourishment that we see in our hospitals. So, Shripriya, I want to talk to you at this point, and I want to ask you, why are so many children undernourished in our hospitals? What is your view on it?
Thank you so much, Purnota. So it's very important for us to state that cancer is a catabolic disease. So cancer cells require a lot more energy than normal cells. And which is why you see a lot of weight loss in cancer patients. And you would have seen that in, when there is a screening for cancer diagnosis, an oncologist would actually ask you whether you've lost weight unintentionally over the past few months. So, and this unintentional weight loss can actually exacerbate if you are from the lower socioeconomic group, where your nutrient intake is not matching the nutrient needs of the body. And as you know, a majority of our patients come from the low socioeconomic group and come from households where the monthly income is less than 10,000 rupees. This is why we're primarily seeing so much of undernourishment in our children.
Right. Thank you for that, Shripriya. That brings a question to my mind, Dr. Kannan, that if that is the rate of undernourishment that we are seeing, just because, cancer is a catabolic disease, as well as these kids come from the lower social economic strata. In your view, how does nutrition impact the line of treatment for childhood cancers? For example, in your experience, have you ever had to alter the treatment or the dosage because the patient was extremely undernourished?
So if you look at cancer treatment, especially our own area, many of the kids are undernourished to start with. And then during treatment, they have drugs which make them nauseated, which makes them throw up, and they won't eat. They have mucositis, they won't eat. And then if they are not well, if their performance is poor, then their ability to tolerate treatments becomes poor. And then there are breaks in treatment, and this is not in the interest of patients. See, it's all the more important because pediatric cancers are so highly curable. A large majority of kids will eventually grow up to become adults and lead a normal, productive life. And so it is very important that we focus on their well-being before starting treatment, during treatment, and following treatment to ensure that they have a fair chance of making it well and growing up as other kids do. And so sometimes it happens, because they are unwell or, making compromises, which is really undesirable.
Thank you for that, Dr. Kannan, and thank you for really bringing the point of how curable childhood cancer is. When I started off about 10 years back, I was really amazed to see the statistics of, if caught and treated in time, just how curable it is and what kind of a productive lives these kids go on to grow and lead. And also, it's really unfortunate about, the side effects that happen, and, the treatment that you just said you sometimes have to alter because of undernourishment. And, you know, especially being a mom, I can talk about myself and I can talk about the focus that I have on nutrition. I ensure that my children are eating well, especially if they're on any kind of medication. My daughter just underwent a surgery, and we have gone like all guns blazing around nutrition. It's just a force of habit now. But, a question that comes to my mind is, what are the scientific reasons for being well nourished when you are on any kind of treatment, Shripriya? I mean, as a as a mom, I wanted to know that.
Yes, Purnota. Sometimes I feel we forget the simple reasons why we actually need to, eat well-nourished, good food. The nutrients in the food helps the body heal. And when you are on any kind of medications, that time it basically helps the medicine work, period. And which is why a well-nourished child, with cancer means the child will tolerate the side effects in a better way. The child will tolerate the treatment better. And the chances of survival is actually increases when a well-nourished child goes through chemotherapy. I mean, just simple to say, like they just have the energy to walk around when they're undergoing, a chemotherapy or any other form of treatment, and they have a better quality of life. Which is why, as Dr. Kannan also said, it's extremely important that nutrition be paid attention to throughout the course of the treatment. So a nutritionist needs to go in, she needs to evaluate the nutritional status of a child right from diagnosis through these different phases of treatment. And if there is a need for a nutrition intervention, if he or she recognizes a gap, they have to be able to fill in and give adequate nutrition supplementation to that child.
Thank you, Dr. Shripriya. I mean, I'm coming from experts like Dr. Kannan and you yourself. It creates a sort of awareness about how important nutrition is during treatment. Again, I can talk personally. When I started off, I was shocked to see what a critical role nutrition plays. And for all those who are listening in and tuning in, I want to speak about the key role that Shripriya just spoke about, the nutritionists play in terms of not only assessing and diagnosing a child's rate of malnourishment, writing a nutrition prescription, but also giving her what she needs during her treatment period. Everything that's in the prescription and more. One of the key things that we do actually, which again came about under the guidance of doctors like Dr. Kannan, Dr. Brijesh Arora, etc., is to say that these families need food support. They need support. We need to ensure that the children are well fed while they are in treatment, whether they're in the hospital or they are at home. And for that, we give each family a ration basket, which has everything a family needs to sustain their nutrition over a period of 1 month. And I want to, at this point, Anju, ask you a question. And the question is that, I know you have been this is all logic and common sense that a child needs to eat well. But I know that you have been toying and playing with data for very long around this. And I'm really interested in knowing that what are the chances of a child continuing treatment after being supported by food aid based on the data that you see?
So what we've seen, Purnota, is that 95% of patients continue treatment when nutrition is a part of it. And last year, our rate was 94%. So we're seeing that trend remain the same over the past 2 years. And recently, we've also had a third-party evaluation conducted at a subset of our hospitals where they evaluated our programs. And what they found was that 100% of caregivers agreed that our programs positively impacted their ability to continue with the treatment.
Very happy to know that. It's actually common sense. It doesn't need data, sick child, food, the child will continue treatment. But it's interesting to see it supported by facts as well. Dr. Ravikannan, at this point, I want to take a minute to thank you for the kind of support that you have been giving Cuddles Foundation over the last 1 year. It's through the support of doctors like you that we are able to work and work effectively and have impact numbers like this. So I would love to hear from you, your personal experience or your understanding of what role does a nutritionist play in ensuring that the child as well as the caregiver are making the right food choices, not only during treatment, even post-treatment. And the second part of this question is, personally for you, how does having a nutritionist support the work you do help you or help a doctor like you?
So we should be the people thanking you because you are helping patients directly, impacting on their ability to complete treatment. Now, as far as the nutritionist goes, I think it's a very, very, very important role that they play. It is one thing to prescribe and expect that they will take whatever we advise. It's another thing to provide the material that they will use for food. But even more important is to supervise and ensure that they are actually taking the food. See, that is critical to be able to talk to the parents, convince them, sensitize them, take care of their fads and beliefs that something is not okay. Making sure that the child actually consumes what is prescribed is, I think, crucial. Say we have a policy of keeping all our pediatric patients in the hospital because abandonment rates are very high. Even leukemia, till they start maintenance, we don't send them home. And so the presence of a nutritionist who does rounds every day, sits down, chats with the mothers, laughs with them, observes festivals, celebrates with them for Christmas, for Diwali. And so all of this adds to the ability of the nutritionist to be a very important influencer in the child's nutrition and ultimately care program. And at this point, I would actually request that if possible, it would be important for the nutritionist also to make home visits once in a way for children who intermittently go home. See, what happens is parents are often afraid that they have this nutrition support. What happens if it dries up? Will they get the next batch? And so, all these fears are there. So sometimes when they go home, if we say 2 scoops, they will give 1 scoop, trying to, keep something for another day. And so it is important that and so you can understand, a nutritionist plays a very, and as doctors and nurses, we won't be able to give this kind of time for something like this, And so thank you very much for supporting the position of a nutritionist as well. It's invaluable, trust me.
Yeah, thank you so much. This appreciation goes a long way in not only boosting our morale and boosting the nutritionist's morale. And, you brought this beautiful point. Actually, you brought 2 beautiful points. The one is how a nutritionist becomes an influencer. And with the advent of social media, etc., we all know power of influencers. And here is one person who integrates herself in the lives of the parents, their happiness, sadness, joys, festivities, and influences right food choices, which I believe will have a community impact, Dr. Kannan, not only in the families. This mother will go and speak to 3 more mothers, her friends, her sister-in-law, etc., who then will adopt the same food choices. And the other important point that you brought to our notice that we are going to seriously work on is the importance of home visits, I'm sorry, where after a child finishes and goes, I think you're absolutely right that home visits is going to go a long way to make sure that the child sticks to the maintenance and gets well. So at this point, we all know about the current crisis, the climate crisis in the Northeast. It's remarkable you're holding such a brave face. You're giving us time to do this at this time. What I wanted to talk about, very few people realize that last year our kids, or any patient for that matter, were fighting a fight on two fronts, which was COVID and cancer. And now in the Northeast, this has become a fight on three fronts, which is climate, COVID, and cancer. What is the situation there as we speak?
So the acute phase is more or less settling. The water levels have started to recede, and roads are opening up. Now the next challenge starts. There will be waterborne diseases, and kids who are sick, who are on cancer treatment, will be more prone for many of these diseases, and we have to be cautious and careful to prevent this from happening. The other thing is, some of these kids who have gone home, whose parents, for whatever reason, are marooned and have not come back, we have to ensure that we bring them back ASAP for treatment, because treatment breaks are undesirable. And whatever it takes, if we have to go fetch them, whatever we have to do, we have to do. Several of them have lost their houses, their belongings, their utensils, and we have to figure out a way to try and help repair and rehabilitation. This includes my own colleagues in the hospital as well. Then we have to also put in place measures to counter future shocks. So all of this is what will happen now, and we will get around it.
Yeah, I mean, it's amazing the kind of, we've all been reading about the work that you and your colleagues have been doing. It's amazing. Hats off to you. I do know there is a uphill road in front just as the water recedes, as well as figuring out, like you say, most of us don't think about the counter future shocks, So yeah, there is a road to be traversed, but to everyone who's watching here, I'm requesting you to reach out and to help out in any way that's possible, which sort of brings us to the end of this conversation. So a huge thank you to you, Dr. Kanan, first for joining us
Thank
despite
you.
everything that's happening. Thank you, Anju, for all the hard work. And thank you, Dr. Shripriya. I know that both of you have been at it. The link to the report, if you want to see and read the whole report, is in the comment section below. If you're reading, or I'm sorry, if you're seeing this on YouTube, it's in the description. And I want to end this by requesting you to support Cuddles Foundation and sponsor a child's nutrition journey through treatment, because for two reasons. One is universally, every single child deserves a chance at cure. And if you can share, why not? The other reason being that everything that we do, you're seeing here, is transparent. It's backed by data, and backed by people, professionals like Dr. Kanan, Anju, etc. We make sure that your money, every single penny, goes the longest way it can. So please head to donate.cuddlesfoundation.org. The kids and us, we really need you. Thank you so much.